Imagine that you have just delivered a big, healthy baby after being in labor for over 6 hours, and you've been pushing for 2 more. At the foot of your bed is your obstetrician. The one you've been seeing since your 6th week of pregnancy. The one who assured you everything was okay, and you believed her. What you don't see behind her mask is anxiety and panic. When she delivered your beautiful baby, you had a tear that extended into your rectum, and she doesn't know how to repair it. She is not a resident in training. She is a board-certified OB-GYN physician, but she had to call for help so that someone could help her do your repair. Welcome to the current medical reality. Every year, more than 20,000 new doctors walk across a stage, receive their diplomas, and step into hospitals with a single goal: to heal. But what if I told you many of them are stepping into that role unprepared? Not because they lack heart, but because the system that trained them is broken. A recent New England Journal of Medicine article reveals a painful truth. Too many doctors enter the workforce without basic clinical and procedural skills. They're not ready to manage critical information, struggle to work in teams, and aren't equipped to participate in quality improvement. And that's not a small oversight, that's a public safety threat. The authors didn't write this to blame. They wrote it to warn and improve the physician's clinical skills. Because our medical education system is failing its social contract. The promise to prepare doctors to meet the health needs of real patients in real communities. And as an OB-GYN who spent decades in hospitals, I've seen the cost of that failure firsthand. When physicians make errors in labor and delivery, when they miss the warning signs, when they over-rely on technology instead of their training, mothers die, babies die, families are shattered. Not always because of negligence, but because they were never taught what to look for. And yes, smarter use of technology like AI to flag patterns clinicians might miss. We also need to address who's missing from the conversation. Hospital administrators, policymakers, and yes, patients all need a seat at the table, because when leadership doesn't reflect the people it serves, the outcomes are always worse. Are we graduating competent physicians or just issuing diplomas? Share this video. Tag a healthcare leader. Ask your alma mater. What are you doing to ensure your graduates are ready? Because if we don't fix this system, more patients will pay the price,